Up until the 1970s, the Australian states and territories used the British model of health and safety in the workplace. It was a prescriptive approach with detailed specification standards and technical rules that were often difficult to understand and constantly in need of updating as workplaces evolved. Coverage for workplaces across various industries was uneven, and there was a tendency to focus on factory-based hazards. Overall, the model wasn't cost-efficient. During the 1970s, in line with the UK's Safety at Work legislation, the prescriptive approach was changed to systematic self-regulation in Australian states and territories. Significantly, this placed a statutory duty on employers to consult with employees or their representatives. Health and safety representatives, or HSRs, help develop safety measures by enabling better communication between employees and employers about workplace risk and hazards. The HSR was elected by workers and given broad powers including the right to training, information, consultation, inspection, and the ability to issue provisional improvement notices. The system gave workplaces an opportunity to take responsibility for managing risks, rather than being told how to manage them. From the late 1980s, there was an emphasis on general duty requirements, performance standards, process requirements, and documentation. There was a focus on the duty holder's responsibility for goals and outcomes. It encouraged problem-solving and initiative. In the 1990s, the federal Labor government began a push towards national uniformity in standards, regulations, and codes of practice. This included regulation of areas like operation of industrial equipment, storage and handling of hazardous substances and dangerous goods, safe levels of noise, and requirements for manual handling. The push for national uniformity slowed in the late 1990s under the federal Liberal government. When federal Labor was re-elected in 2007, it was put back on the agenda.
Prior to the introduction of the work health and safety legislation, we had 10 sort of jurisdictions, whether that be state, territory or the federal system, all philosophically trying to manage workplace safety.
While all jurisdictions were trying to create a safe workplace, inevitably there were differences in laws and policy. This meant the HSR's duties varied significantly between states in areas such as issuing provisional improvement notices or the ability to cease work. It was difficult for businesses to operate efficiently across the states and led to large and prohibitive compliance costs.
With regards to the changing nature of the workplace, we've come from a system where the legislation was put together back in the 1970s from the Robins report, where fundamentally it was an employer-employee relationship, to a system now where we've got the employee-employee relationship still, but we've also got franchises. We subcontract a lot of our work out. So there's been a change in, I guess, nature of the working relationship, which has seen duties owed to those employees that weren't, I guess, covered as explicitly as they are now in the workplace health and safety legislation. So back in July 2008, the Council of Australian Governments, otherwise known as COAG, sort of met together to sort of establish an intergovernmental agreement with regards to establishing harmonised health and safety legislation. This intergovernmental agreement was signed off by all the states and territories and also the federal government.
Safe Work Australia started developing legislation in mid-2009 and created the model for the new Work Health and Safety Act. The proposed Act was then issued for public comment. Over 480 bodies, including unions, industrial and business groups, workplaces, volunteer organisations, community groups, employees and employers, commented on how the legislation would impact workplaces. Safe Work Australia assessed the feedback before reworking and remodelling the proposed Act. The revised version was again released for public comment. The new legislation seeks to harmonise work health and safety across Australian states and territories so that they can operate from one set of terms, one Act, and one piece of legislation. In doing so, it will help streamline the national economy. The four main objectives of the new laws are to protect the health and safety of the workers, improve safety outcomes in the workplace, reduce compliance costs for business, and improve the efficiency of the regulator agencies.
One of the primary reasons for the changes as well to the workplace health and safety legislations is the costs that are associated to workplaces having to manage their OHS across different states under different regimes. By aligning the workplace health and safety legislation, there's a significant cost saving to the organisation through a reduction in their, roles around compliance. But there's also a reduction in the cost to the regulator.
Prior to the federal WHS legislation, the 10 regulators would review their jurisdiction's legislation once every 5 years. Harmonising the WHS legislation allows the regulator to perform its role more effectively, including assisting with the education and implementation of safe work practices and investigating and monitoring compliance. The roles and responsibilities of individuals in the workplace have been clarified, and the standardised laws mean greater consistency. The WHS legislation has important new terms and definitions.
The person conducting a business or undertake is the principal duty holder under the workplace health and safety legislation, commonly referred to as the PCBU. The PCBU refers to the persons within the organisation who ultimately control and influence the activities of the organisation.
PCBU has replaced the term employer in the legislation. This reflects changing workplace relationships. It expands upon the employee-employer relationship to include engagement of consultants, subcontractors, franchise agreements and other arrangements including voluntary work or work experience. The PCBU's primary duty of care is to ensure the health and safety of workers and those carrying out work as is reasonably practicable. Determining what is reasonably practicable involves assessing the situation in terms of how likely is the hazard or risk to occur, the severity of the harm that may result, how aware the relevant person is of the hazard or risk and what they are doing to reduce or eliminate the risk, whether it is possible to reduce or eliminate the risk, and whether the costs involved in reducing or eliminating the risk are in proportion to the risk itself.
Reasonably Practical also looks at ways that the organisation can eliminate the risk or eliminate the hazard in the workplace. What have they trialled in the past and what has worked, what hasn't worked.
Officers are the senior decision makers within an organisation who determine the way in which they operate. Officers shouldn't be confused with those who contribute information to the decision-making process.
One of the other significant changes is that it's quite clearly defined as to who takes on the role of officer within the organisation. Not only are they the significant decision makers, but they're also the persons who are defined as an officer under the Corporations Act.
This has removed the subjective element regarding who performs the role. A worker is defined as anyone carrying out work for a PCBU. This includes employees, contractors or subcontractors and their employees, employees of labour hire companies, trainees or apprentices, work experience students and volunteers. A WHS entry permit holder is a union official or other person holding an entry permit under the Fair Work Act 2009 or relevant state law and has completed the necessary training. This allows them to enter any workplace with members or prospective members of their employee representative body. The PCBU must be notified about any such entry as soon as is practicable. The health and safety representative is elected by the workers to represent a work group. Their role is fundamental in the consultation and communication process.
Health and safety representatives will typically represent a designated work group where there are similarities in the type of work that the work group does, whether that be actions within the workplace or times of the day-to-day works.
The HSR is the contact point for workers for addressing and resolving health and safety issues in the workplace. They undertake training that covers the WHS legislation, risk assessment, and the consultation processes involved in maintaining a safe work environment. Due diligence is another key term.
It means that those people who sort of hold the officer role in the business will have a thorough understanding of the hazards that are associated with the business, how the hazards within the business can be managed, understand the compliance activities that are in place within the business from a legislative or a procedural requirement. So this might be notification of incidents, this may be completing workplace inspections or whatever structures they've set up within their workplace to maintain a sort of safe work environment.
This includes WHS audits, first aid checks, and reviewing incident investigations.
And also there's a requirement for them to establish effective consultation mechanisms so that the hazards that the people on the shop floor are aware about can be sort of easily communicated through management up to senior management to allow them to make decisions that will impact and affect the business.
Authorisation refers to the required licences, permits, registrations or other authority in order for certain work to be performed. This includes high-risk work, work at locations where there are major hazards, and use of certain plants and substances in the workplace.
The codes of practice are our practical guidelines that provide workplaces with an understanding as to how they can meet aspects or elements of the Occupational Health and Safety Act or Work Health and Safety Act and Work Health and Safety Regulation.
The codes of practice provide clear instruction on health and safety in areas such as manual tasks, dangerous goods, plant or equipment, and consultation. The codes of practice offer guidance and advice but are not legally binding.
There are 3 notifiable incidents under the Work Health and Safety legislation, these being the death of a person, serious injury or serious illness occurring to a person in a workplace, as well as dangerous occurrences occurring in the workplace.
Dangerous incidents include near misses in the workplace. An incident or injury may not have occurred, but there is a real likelihood for an injury or illness to occur if the process were allowed to continue. When an incident does occur, notification must be immediate.
For serious incidents or dangerous occurrences, notification needs to occur as soon as the PCBU is aware of the incident occurring. There are a number of ways that the PCBU can contact the regulator, these being by phone or by email. With regards to legislation, it clearly stipulates that notification must occur as soon as possible by the fastest means. So in most occurrences, we'll see workplaces phoning through the incident to their regulator within their state.
Reporting must be done as soon as is reasonably possible. This can depend on factors such as location, access to communication, and time of day.
In addition to this, what the regulator may ask for once you have made the communication by telephone is written documentation of this phone call, and typically the timeframes will be within 48 hours that this needs to be completed and submitted back to the regulator.
The incident site should not be disturbed until the inspector arrives or otherwise gives express permission.
Preserving the incident site is another sort of fundamental requirement once a notifiable incident occurs within a workplace. There are a number of reasons why we need to preserve the incident site, and this is primarily a result or to primarily allow the regulator, should there be a need to conduct an investigation, to get a full understanding of the events that have occurred within the workplace.
The incident site can be disturbed in circumstances where it will save lives or prevent other serious incidents occurring in the workplace. Under the new law, the types of offences have changed.
Offences under the workplace health and safety legislation are based on risk and culpability, not the actual harm that they cause.
Offences are divided into 3 categories.
Category 1 offences refer to offences where the duty holder has recklessly endangered a worker or a person involved with the business or undertaking that may lead to a serious injury or a serious illness.
This is the most serious offence as it involves reckless conduct. For Category 1 offences, corporations can be fined up to $3 million. Persons conducting a business or undertaking or offices can face fines of up to $600,000 and/or 5 years jail time, and workers up to $300,000 and/or 5 years jail. Category 2 offences relate to a person who has a health and safety duty under the SIRXWHS Act, and their failure to comply with that duty has led to a person being exposed to risk of death, serious injury or illness.
When we're having a look at Category 2 offences, we're looking at corporations being fined up to $1.5 million, persons conducting a business or undertaking or officers being fined up to $300,000, and workers being fined up to $150,000. When we're looking at Category 3 offences, what we're looking at there is we're looking at the situations where the procedures or the legislation has been breached.
The person who has a health and safety duty under the SIRXWHS Act has failed to comply with that duty. A person doesn't need to be exposed to risk of death or serious injury or illness for it to be an offence.
Again, there doesn't need to, in any of these circumstances, be actual harm, as long as there's been a situation that provides an opportunity for harm to be caused to an employee, then the offence can occur.
The penalties for Category 3 offences are: corporations can face fines of up to $500,000, persons conducting a business or undertaking or offices can be fined up to $100,000, and workers up to $50,000. The new WHS legislation is the next step in the continual evolution of workplace safety. It is designed to improve health and safety in workplaces across the nation by harmonising standards and laws, as well as making it more cost-effective for business to comply.